Okay, so we're at 9:30.
Camilo, we're ready when you're ready.
Okay. Well, I'd like to just welcome everybody who has joined the presentation. Welcome to the Brown & Brown ESM Insight Safety Reboot. This is your return to work strategy and framework. So before we get started, just a little housekeeping here. The presentation will be focused around workers' compensation and the risks therein with the return to the workplace, safety and Cal OSHA compliance, both in general and in response to the new COVID-19 requirements that have been rolled out. We'll be presenting a framework for risk management moving forward. And as far as the format of the presentation, feel free to chat in questions that you might have throughout the meeting as they arise. If they are somewhat general in nature, we may address them in the meeting. If they are more specifically tied to your individual business, we can always engage afterwards and continue the discussion offline. So my name is Camilo Sharp. I am the sales manager, sales leader here at Brown & Brown Insurance. We are obviously your one-stop shop or full-service insurance brokerage, handling your commercial property and casualty needs, group health insurance and other employee benefits, as well as all your personal lines insurance needs. And I'm very glad to introduce our business partner, ESM, which is who Brown & Brown has partnered with to provide workers' compensation risk management services. ESM is a tech-enabled risk management company that helps employers manage safety and compliance programs such as COVID-19 requirements, workers' compensation claims advocacy and return to work services, all of which help reduce and control an employer's ex-mod and workers' compensation costs. Their goal is to help clients reduce the cost and impact of workers' compensation, and they do this through their technology portal called Insight. Co-hosting today is Anthony Poston, CEO of ESM, and I'll go ahead and let Anthony introduce himself and his team.
Great, thanks Camilo. Welcome everybody. Thank you for joining today. I've also got Sinead behind me. She's going to introduce herself in just a second. She's going to run all the back office on this presentation. A little bit about myself. I've been in risk management for 20 years, started 5 years at Charles Schwab as a risk analyst, moved into ESM about 15 years ago, surprising that we're 15 years old now and going through this crazy journey of COVID-19. So excited to share some of the resources we put together for you. We're going to be sharing all this information. We're going to follow up with some of the tools that we've talked about during this presentation. I see a question already about the recording of the presentation, and yes, we're going to be recording that and distributing that to everybody as well. So thanks for joining. Sinead, do you want to just give a quick overview of yourself?
Sure. I'm Sinead Scrisopi. I am customer success at ESM. My primary focus at work is to always ensure that our clients have all the tools that they need to be successful managing their workers' comp and safety programs. As mentioned, I'm going to be in the background kind of running the presentation. If you have any questions, feel free to chat me. Like was mentioned, if we don't get to your questions live today, we'll email you separately, and you're going to get a follow-up email as well with my contact information. So always feel free to reach out if you have any questions or if you need anything. All right, so let's get started.
Let me take this one. So we have been going through this journey of COVID-19, and in February, we really started to see it impact the US. It started in China, as we all know. We've become very much subject matter experts in this whole topic. And so in March, we started to put together, first part of March, an exposure control plan, and that was really geared towards infectious disease and preparedness, which encompassed bloodborne pathogens and aerosol transmissible diseases. Well, as we started rolling through March, all of a sudden the shelter in place was enacted. So we put together a remote work program because under workers' compensation, while your physical location is the primary exposure, now that we have employees working out of their homes, that is an extended work site and it's covered under workers' compensation. So we put together some remote work programs, some ergonomic policies and procedures related to OSHA Standard 5110. And then we had a lot of questions into this phase 3 process of, I've got a lot of open workers' compensation claims. I can't provide modified duty because my employees are sheltering in place and they're at home. How can I manage these employees? How can I reduce temporary disability payments that are starting to ratchet up because I'm not allowed to provide my employees with modified duty at the work site? And now fast forward to phase 4. We've become very smart about this whole pandemic, about this virus in particular. OSHA has enacted new provisions related to the infectious disease preparedness plan standard, and that really is targeted specifically to COVID-19 mitigation strategies. We're going to talk a lot about that today. And then we've also started phase 5 of this whole journey, which is the executive order. Camille is going to talk a little bit about that today, and then we're also going to be rolling out another webinar in the next week or so, talking about how COVID claims are now covered under workers' compensation and what kind of impact that's going to have on employers and what they can do to mitigate that. Let's go to the next one, Sinead. So Abe Jaban is an attorney on our team. He's going to be rolling out that executive order webinar. Expect to see that probably in the next week or so. And again, all of this information that we're going to present to you today might change tomorrow. So we're constantly getting new data, new analysis, new recommendations, new requirements. Today, what we're really going to talk about are what are the requirements versus what are the recommendations, and what can you do now? What actionable tools can you put in place to help comply with these new regulations, but then also keeping your people safe? So we don't want to lose sight of the human element, which is really to flatten the curve and eliminate this pandemic to as much as we can. Throw it to you, Camila.
Right. So, yeah, COVID-19 will be the largest event in insurance history. Quote Evan Greenberg, CEO of Chubb Insurance. Bigger than 9/11, bigger than all major hurricanes. And what does that mean for the insurance industry? And what does that mean for rates moving forward as we absorb the cost of the impact of COVID-19? As we move forward, it is absolutely critical to have a comprehensive safety plan. One of the reasons we are putting together this timely presentation, as the lifting of the restrictions commences, risk mitigation strategies are absolutely essential. So looking more at California, and the requirements or phases the phase that we are currently in more locally. So California has the 4 stages of reopening. We're all fairly familiar with it, depending upon which part of the state we are in. We're kind of in the stage 2.5, where we're somewhere between gradually opening some of the lower risk workplaces, the opening of some curbside pickup for retail, manufacturing, offices slowly if telework is not possible, and slowly getting towards the stage 3 phase where we're opening up personal care salons, gyms, entertainment venues, in-person religious services and whatnot. And depending upon, which part of the state you are in, you might be closer to stage 3. Obviously here in the Bay Area, these things are rolling out quite slowly. So in response to the COVID-19 pandemic, the WCRB has put 3 recommended amendments on how they're treating payroll and workers' compensation exposure in response to the COVID-19 and the shelter-in-place orders. Some of the things that they've put out there is, number 1, the division of an employee's payroll between classification 8810 clerical office employees. So employees that have been able to continue to work from home, but maybe in a different capacity than what their normal exposure is, as far as being a laborer or some other type of class code. It's the temporary reassignment of the 8810 clerical class code to that particular payroll. Second is payments made to an employee while the employee is performing no duties of any kind in service of the employer, to be excluded from payroll when the payments are equal to or less than the employee's regular rate of pay. Basically, what this translates into is that the WCRB is looking to create a COVID-19 class code, if you will, to put all of that payroll that is being paid to employees who are not working at all. The goal here is to keep that payroll out of the mix as far as not counting towards the calculation of your experience modification, and also not to be charged a premium from your workers' compensation carrier. The thought being here is that if these employees are not actually working, then there is no work exposure there as far as risk of injury. And then third and final, COVID-19 claims will not impact the XMOD. The WCRB has basically said that all COVID-19 claims are going to be deemed compensable, and the costs associated with handling those claims will not be impacting the XMOD during this time. The most important thing here moving forward and throughout this shutdown period is keeping diligent documentation, accurate payroll ledgers of however you are treating your employees during this time, whether they are being paid normally, whether their jobs have shifted or their responsibilities have shifted now that they're working from home. Accurate documentation, diligent documentation is absolutely critical moving forward, because in the event, because all of these relief amendments that have been put out by the WCRB will be adjusted for at audit of your current workers' compensation policy whenever it expires. So having all of that information clearly documented so that you can take advantage of the relief that is put out by these amendments is absolutely critical. And and more importantly, keep a separate log of any COVID-19 claims submitted to your carrier, just to make sure that there's no confusion there as far as any of the information related to these COVID-19 claims. So moving forward, as we get through the renewals, and every business has a different workers' compensation renewal date. Some of them are during this time and others will be outside of it, but carriers are really shifting their focus as well to COVID-19 and how it's impacting businesses moving forward. And they're starting to ask a lot of questions regarding, the return to work strategies of employers. If impacted by the current environment, what is your business resiliency plan? How will you protect yourself moving forward, protect you and your company? And how do you plan on navigating, the new COVID-19 work environment? If the insured is considering impacts to the number in the workforce, potentially through layoffs or furloughs, what steps are being taken during this transition? This is obviously to mitigate the chance of post-termination claims and some of the consequences that can occur from a reduction in workforce and how that impacts your workers' compensation moving forward. Considering the current situation, are the payroll estimates provided still accurate? Annual payroll projections that were put together 3 months ago may have been completely blown out of the water by the events of the past 3 months. And then moving forward, what facility cleaning and employee protections, including personal protective equipment, is in place? If one or all of the facilities of an insured have been closed, what is the plan to reopen them, including plans for cleanliness and electrical inspection and the restarting of idle equipment, and cleaning things moving forward as they are now being used. So Anthony, I'm going to toss it back to you now.
Anthony, are you on mute? I think you're on mute right now.
Thank you very much. I thought I clicked it. It never fails. Whenever you're giving a presentation, there's always one little thing that goes wrong. Thanks, Sinead. Thanks, Camilo. So let's talk about some of the return to work challenges. We've got Fed, state, local requirements that are constantly changing. Are they requirements? Are they recommendations? We're getting a lot more data on this virus and what we can do as a race to really mitigate it, as well as what we can do as an employer to mitigate it. And some of the challenges that I really think are going to play out, we're going to talk about this throughout the rest of this presentation, are as we bring employees back to work, consider that these employees have been sitting at home for 60, 90 days, somewhat degenerating, not going through the same work disciplines that they had before. For example, we're working with an HR contact. Her husband was an electrician. Pre-COVID, he was walking 20,000 steps a day. After COVID, he was sheltering in place at home, not really working, and he was walking 1,000 steps a day. Now we're going to take that employee and put him back into the workforce and expect that he's going to be able to lift 50 pounds, twist, turn, do all the things that he was doing pre-COVID when he had those work disciplines and he had that fitness for duty. So those are going to be some of the physical challenges that we're going to see. The other challenge is we're going to see a lot of new employees in the workplace. I've had some construction companies say my job didn't come as fast online as other union projects. Therefore, I have new union employees that are coming to my project. They're unfamiliar with my processes, my team, my project, my site. So now I've got more exposure of this person who's been sitting at home, maybe physically isn't prepared for the job, let alone isn't familiar with the job. And of course, there's no one size fits all. So we're going to talk about construction. We're going to talk about manufacturing, talk about retail. We've got a lot of different examples and different employers that we're working through some challenges right now. So we're going to try to create a one size fits all within this presentation, but just know that what we're preparing for you and the tools we're going to provide can always be modified to match your organization. So let's talk about some of the psychological hurdles that we're going to be seeing. Sinead, move us forward. So we have been working with different employers. They're doing surveys to their employees, finding out whether or not they're going to be returning to work. I'm actually working with a property manager after this call who has about 60 folks, 60 people in their corporate office. They've got resident managers across 200 properties. They've got a maintenance team that goes out to these properties and does in-home maintenance work. And sometimes there are folks in the tenants actually in the apartments. So how are we going to control all of these different variables? What are we going to do to manage the exposure, keep our employees safe, as well as keep the general public safe? And so we're going to talk about some of those strategies through this. There are a lot of anxieties. I'm sure a lot of you have kids out there. You're worried about whether I bring my kids back to school, what's school going to look like. So there's just a lot of unknowns. And when we have those unknowns, we get anxious. And so how are we going to overcome those? And what I can tell you from an employer standpoint is we really need to have a good strategy. Talk about what PPE is going to be required. Talk about the social distancing that's going to be mandated. Talk about the engineering controls that you're putting in place, the decontamination procedures, disinfection procedures. So having that into a strategic plan and then communicating that not just with your employers, but your clients as well, or to the general public if you're in retail and you're supporting general public needs. And what we really need to do is start retraining our mind and our body. We have become so enveloped in our own minds. How are we going to get out of that and get back to whatever this new normal is going to look like? And so I actually had a block party on my street the other day, and one of our neighbors got a food truck, and everybody came and they were wearing their PPE and they were doing their social distancing, but it felt normal again. Even though we all weren't shaking hands, we weren't doing high fives, we were keeping our distances, but at least it felt good to get out of our own minds and get back into some of this socialization that we're so used to. One thing I put down here at the bottom here, you can see the employee assistance program. So knowing we're all wired a little bit differently, if you have an EAP, be sure to roll that out to your employees. Let them know that it's available. I think most EAPs offer up to 12 free calls. You usually get that through your health benefits. So it's definitely a program, if you have it in place, that you want to make known to your employees so that if they are experiencing any anxiousness or any potential depression or any just mental challenges with coming back to work, that they do have resources available. So again, revisit your EAP if you have it, and then be sure to include that in part of your strategic plan. All right, so let's talk about some of the reopening requirements. So Governor Newsom put out these requirements, and you can see the links down here at the bottom. Everybody will get a copy of this presentation and a recording of it as well. And so I went through the whole requirements, and I really took out these 5 steps. And the first one is perform a detailed risk assessment and a site-specific protection plan. The property management company that I mentioned has all those different exposures. So having a specific plan for them for each one of those different business units is what we're developing. You have a manufacturing plant, maybe you've got different departments that you can silo. I'll talk about one of our manufacturers who's got 3 confirmed COVID cases right now and what they're doing. The next step is having employees screen themselves. So we're seeing a lot of temperature checks when employees get to the facility. They're having them fill out a questionnaire when they get to the facility, or at least answer those questions, whether you have any of those symptoms or not. But what about doing that at home? Why can't we go upstream? Have the employees self-assess at home. And if they are feeling any one of those potential symptoms, maybe it's allergies, maybe it's a cold, but at least we have them stay at home and not come into the facility, or we're going to test them and send them back anyway. The next one is individual control measures and screening. So as I talked about, maybe we've got somebody at the front lobby who's doing temperature screening, temperature checking, asking some of the symptomatic questions. Maybe we limit our visitors during this time period until the foreseeable future. And then the next one is disinfecting protocols. This one is really important. So as Camila mentioned about record keeping, one of the things that we really need to maintain as we're implementing our strategy is documentation. I can tell you OSHA is out in force. In fact, I just sent this email to one of our clients. OSHA's got 7 new guidelines, which we're going to talk about next. They are stepping up their inspection and investigation process related to COVID. And there's also been over 15,000 employee complaints to OSHA from employees who are saying their employers aren't implementing their mitigation strategy or they're not adhering to it. So we've got a lot more eyeballs on our plan than just OSHA. Our employees are looking at it. They want to feel safe. They want to overcome some of these anxieties I mentioned. So having a really good plan, implementing it, and then documenting that you've actually implemented it. And then the last one is the physical distance, the social distancing guidance. So we're going to talk a little bit more in depth on how to do these. And then Sinead, let's talk about the OSHA reopening guidelines, which is the next one here. So as I mentioned, in March, we had prepared this infectious disease and preparedness plan. And that has evolved dramatically over the last 3 months to now where it's been more fine-tuned to specific COVID-19 mitigation requirements per OSHA. The next one is having infection prevention measures. What happens if somebody does get infected, which moves into the next one? How do we isolate them? How do we send them home? How do we manage that potential COVID-19 exposure, both at the facility once the employee leaves? Did they infect the department? Did they infect the people within the department? Are we going to quarantine them at home? When do we bring them back? And so forth. And then also, what about workplace flexibilities? So can we offer remote work to some of our administrative staff? It's obviously going to be very difficult for manufacturers, construction, other laboring jobs where you have to have the people within the facility. So how are we going to protect them while they're working within the facility, but also how do we protect our employees that are working at home? And that leads into workplace controls. And my favorite one, which is follow OSHA standards. That couldn't be any more vague. And there are extensive OSHA standards. So things like bloodborne pathogen, PPE, hazard communication, respiratory. There's a lot of standards that we now need to comply with that roll up into our infectious disease and preparedness plan. So we're going to talk about some of those specifics today on how to manage those, but very important that you do have policies and procedures related to your loss leaders. Because as I mentioned, OSHA is stepping up their inspection and enforcement game related to COVID-19. But I will tell you that I just received a $5,300 citation letter from OSHA to one of our painting contractors. The employee fell off a ladder from a seizure, had an injury, was taken by ambulance. And so OSHA came out, did the inspection, and issued 9 citations related to 5 standards that have nothing to do with ladder safety or fall protection. It was not having a heat illness plan, not having an IIPP, not having a respiratory plan, not having a hazard communication plan. So nothing related to the actual injury itself, but more geared towards policies or standards that that employer needed to comply with. And then the last one, classify worker exposures to COVID-19 risk categories. We're going to go through that exercise today in this presentation. Okay, so it's here. It's time to get back to work. Some of you logged in early. I know you could hear us talking. As Sinead mentioned, and I did, the person who cuts my hair, her hair salon is now back open. And so they're working through what their mitigation strategies are. And as you'll recall, that is really stage 3 of this California 4-stage plan. So good news, we're getting back to work. The challenge is just going to be overcoming the anxieties, making sure that we have good mitigation practices in place. Because again, not only do we have OSHA, the CDC, the WHO, the county health departments, local ordinances, all looking at what our strategies are. And then we have our employees as well that are going to be monitoring that. So let's talk about our reentry framework. We put together 6 steps. And this first one is the business reentry checklist. We're going to talk about that. And that goes back into the site assessment that the governor had recommended or required for employers to look across your organization, determine the risk, and determine what the strategy is to mitigate it. The second one, once we've done the exposure control risk assessment, now we want to put together the exposure control plan. And so we're calling our plan the exposure control plan, although it's infectious disease and preparedness, but we've incorporated more of the COVID-19 strategies related to all of the different fed, state, and local requirements. So it's more than just the infectious disease. It's really how we're going to control this exposure. Third one is worksite cleaning protocols. Fourth one is social distancing. The fifth one is worksite controls, which are more engineering or even administrative. And so that is the beginning stages of getting our plan in place. And then step 6 is going to be implementing it and reopening. And we've got a few steps underneath there. It's one layer down. We'll talk about what specific requirements and tools we can use to manage this program that we've put together. So let's dive into this. So step 1, complete your business reentry checklist with your team. Sinead, let's just jump to the next slide. So I put together just some reentry questions and reentry policies and procedures for you to review. So the first one is, if you have a safety committee, let's convert it into our COVID-19 task force. Or maybe you don't have a safety committee. Let's just create a task force. It might be your HR director, your operations director, whoever is helping to manage a lot of the operational exposures and requirements. So who is that person? Who's going to be the head of the task force? And who's going to develop the plan in conjunction with department managers and supervisors' input? And then how are we going to implement that? Who's going to be responsible and so forth? Do we have high-risk individuals? We know that this virus attacks people with pre-existing conditions, or they're 65 and older. So if we have that workforce, what are we doing to protect them? Can we put them in a lower risk area to prevent them from potential infection? So this is going to go into how we categorize employees into these different OSHA requirements, which we'll talk about in the slide coming up. The next one is PPE. What PPE is required? We know we have to wear masks. I'll give you an example that's a real challenge for one of our nonprofits who does in-home support services for special needs folks. So right now in the Bay Area, this staff is going into a home to provide support services. Well, with the sheltering in place, we're seeing multi-generations of family members quarantining in the same house. So whereas the staff pre-COVID would go in and there'd be 4 or 5 members of the family, now there's 10 to 14. And those family members are going out into the workforce, going back to work, and then coming back into this unit where now this staff member is going into. So there's a lot of fear that they are more in a high risk area because of the potential infection exposure based on this new number of people that are in a very contained area. So does that employee have to wear a mask for the 6 hours that they're in that home providing services? Do the family members have to wear masks? What PPE requirements can we push on the families so that we keep our staff safe? So there are a lot of new exposures and challenges that we're trying to work through to come up with a flexible strategy, because what we know today, based on the data that's been provided, might change next week. And so while we're putting this program together, again, it's got to be flexible and we've got to be able to adapt to what some of the new requirements are going to be. The next one is, what are your physical distancing or social distancing protocols for not only your employees, but also for your customers? Do you deliver to different customers? What does that delivery look like? We've got a cannabis manufacturer that delivers their product to retails. And when they go to the retail shops, they're concerned that they're not practicing these COVID-19 mitigation strategies. So now this employee feels exposed and working in the general public, exchanging cash, exchanging products. So what are some of the things that we can do to protect our employees in that specific regard? The next one is the daily health assessment, and we'll talk about that. One thing that has come up, especially for organizations that own their facilities, the frequency of air filter replacement or high frequency air filters. So kind of look at what your maintenance strategy is, maybe look at replacing those monthly or quarterly, depending on what your current schedule is, just upping the frequency. And then we're going to talk about sanitization and disinfections in just a second. On the right side, we've got policies and procedures. So as I mentioned, we've got employees that have been sitting at home, and now we're going to be bringing them back into the workforce. One of the things that I think is very important is that we review the employee's job description with them. And your job descriptions should have the physical demands within them: picking up 50 pounds, carrying it 10 feet, pushing, pulling, kneeling, crawling, whatever those physical demands are. Review that with the employee. Are they fit for duty? Can they come back to work and be safe? The last thing we want to see is an employee come back to work and get a back strain or a shoulder strain because they're not physically ready, because we've adapted to this new work from home environment for the last 60 to 90 days. Some other policies to review: the Injury and Illness Prevention Program. Your IIPP should only be about 10 pages. If it's more than 10 pages, consider cutting it down, because that is just the umbrella of your safety program. It only requires you to comply with the 8 elements within that. And then your other policies like HAZCOM or PPE or fall protection, those are going to be appendices to your IIPP. And we could go through a whole IIPP training program, which we probably will do with some of you as you start to put together your exposure control plan. Next one is Code of Safe Practices. If you have one of those, it is the 9th element required for construction employers. We actually put that together for all industries just so that they can identify the primary exposures within their facility and then bullet points on how you mitigate those. We'll talk about the rest of these: health assessments, social distancing, PPE, disinfection, and so forth in the coming slides here. So let's move on to the next one. Okay, so as I mentioned, we had put together our infectious disease and preparedness plan in March, and that has since evolved because OSHA has now come out with specific COVID-19 requirements. So we took the original one and we modified it to fit these new COVID-19 requirements. And you can see on the right side, these are all the sections within there. Responsibilities: who's responsible for what at the senior level down to the employee level. What are our worker exposure classifications? We're going to go through that here in just a second. Do we have specific new procedures? Do we have worksite controls? Did we move the machinery to be better socially distanced? Did we move our desks around? how are we working through these requirements? I will tell you, I went to a restaurant last weekend, and every other table had a sign on it that said reserved for social distancing. So it made the employees know where to put the customers. It also made the customers know that they're going to be at least 6 to 10 feet apart from any other customers. And PPE was required. You were able to take it off when you got to your table, but it was required when you were actually walking through the facility. And I'll give you some other examples of some worksite controls here in just a second. What happens if somebody gets infected? How are we going to minimize the transmission? Do we do temperature screening? What does that look like? Are we doing that now? Do we do it for every employee? Do we have the employees take their temperatures at home before they come in? So we'll talk a little bit about that as well. For visitors, if you've had visitors come to your facility or to your job site, maybe consider nixing that until the foreseeable future, probably through the end of this year. Or if you do have visitors, make sure that they are pre-approved and that they understand what your protocols are. We're going to go through some of those specific protocols and what you can do to post those on your front doors. Decontamination procedures. What is your disinfection process? What are your health and hygiene procedures? And a lot of this can be taken from the CDC. And what we've done is accumulate and culminate a lot of really good knowledge information or knowledge transfer from the CDC, the WHO, county health departments, Fed, state, local ordinances, Fed OSHA, Cal OSHA, and so forth. So we put all this together into this plan so that now you have a strategy. And by the way, this is all available down here on our website. We're going to get this out to you as well. It's in a Word document. You can put your name on it, put your logo on it, adopt it, but make sure that it correlates to what your actual operational practices are, and then make sure you have the record keeping based on what those implementation practices are. And you can see down here below, PPE, training, and so forth. Go ahead, Sinead, that's fine. So that was for general industry, and now we also have prepared one for construction. So follows the same outline, the same table of contents. Let's go to the next one, Sinead. Now the county health department in the Bay Area, when construction companies were allowed to reopen the Monday before May 8th, whatever that was, May 4th, May 5th. So the county health department came out with 8 requirements that construction companies had to adhere to if they were going to reopen. And so I put these requirements right here. First, assign a COVID-19 safety compliance officer. And then the second one, which was the most important one for you construction employers out there, is that you had to assign a COVID-19 third-party job safety accountability supervisor, a JSAS. And this is for large projects, 20,000 square feet or more, 10 plus units, but it has to be a third-party JSAS. And I'm going to show you a company that can help satisfy that, which you might already be familiar with. Excuse me. As we move on, developing a site-specific health and safety plan. Again, going back to the exposure control plan we just talked about. Providing PPE, appropriate gloves, goggles, face shields, and face coverings, and also training on those. Because you can provide them the tools, but if you didn't train the employee and you have the signature on your PPE training form, if you didn't document it, you didn't do it. And as Camila mentioned earlier on, documentation is so critical in this whole COVID-19 pandemic. From payroll to your exposure control plan to your record keeping of training, documentation is going to be critical to create an affirmative defense. So if an employee claims that they got COVID-19 at your work site, you're going to have all the documentation to support, look, we onboarded this employee, we went through these policies and procedures, we trained them on donning and doffing PPE, we decontaminate, here's our frequency and our daily cleaning inspection form. You're going to have all that documentation to prove that this employee is more likely to have gotten it anywhere else other than your work site. And that's really what you're protecting, is you're creating that affirmative defense. But even though COVID-19 claims are compensable and they don't impact you, there still is that injured employee that you have to manage and the potential infections to the other team and the facility that you have to worry about. So I won't go through the rest of this. You can see here, social distancing requirements, minimize the spread, cleaning and sanitation practices. These really roll back up into what Governor Newsom said the state has to do, as well as OSHA says you have to do within their 7 reopening requirements. So they all kind of match each other. They have different terminology, but if you look at how you interpret it and then what you need to do as an employer, we're going to show you those and the tools that you can use to do that. Let's go to the next one here. Okay, so now to satisfy this JSAS, Job Safety Accountability Supervisor requirement, if you're not familiar with OnSite, they're a partner of ours. We love what they do. Pre-COVID, they are a team of paramedics that comes out to your job site to treat first aid injuries. Now, if you have a high frequency of first aid injuries, this could be a benefit because they are paramedics and they're not medical doctors. And the labor code says if you have a first aid injury and it's treated by a medical doctor, you have to report it to the carrier who reports it to the bureau. And so that becomes a frequency tick on your loss runs. We'll have a bakery that has 50 claims a year and about 35 of them are first aid. We call them boo-boos. And so we implemented on-site to come out to the facility and treat those injuries. And so therefore we didn't report the 35 first aid injuries, which were minor to begin with, to the carrier. And we were able to put that as part of our strategy to reduce our frequency of injuries. Let alone, we also found out that the medical provider within their general area was not great. The employees did not like going there, didn't feel they got good treatment. And the whole culture improved when we started treating the employees locally at the facility because we can control those variables. Second, the employee leaves and goes to the clinic. We don't know what the experience is going to be unless we've audited it ourselves. We don't know what kind of day the doctor is going to have. We don't know what the employee is going to tell the doctor. So we're able to control some of that by having on-site come out. Well, when COVID started to hit, especially in the Bay Area, by the way, on-site is in, I think, 8 or 9 different states now. Virginia, who's the CEO, laid off 130 of their paramedics or their team in the Bay Area because construction job sites were down and there wasn't as much of a need. So that was May 6th. May 7th, the requirements are before that. The requirements from the county health department came out and said, look, you got to have a third-party JSAS to come out to your construction site to audit. So Virginia hired back 130 people, got them OSHA 30-hour trained, got them ready to deploy to job sites to help support and provide that JSAS requirement. Now, the thing about the JSAS is there is no requirement for the frequency. So some mid-sized projects, still large projects under the county health department, they're doing it once a month. Larger projects are doing it daily, but you can see here are on-site's resources. They can actually do testing for COVID at the job site. They have the 5-minute test. They can provide the JSAS requirement. They're ready to be deployed. So if you are a construction company that needs on-site to come out to your job site to perform this, you can go to their website. They've got an online form you can fill out to be dispatched, or you can call their dispatch number right there. So great resource. Now, while we're talking mostly for construction, what we've done with on-site on the manufacturing side is I mentioned the manufacturer that had 3 COVID confirmed cases. So prior to that, part of our plan was to silo each department, close the break rooms, the lunch rooms, the common areas, and we put together disinfection procedures that were done twice a day. So once we knew those cases were confirmed in this one department, we closed that department down, sent the employees home, closed the department down, disinfected, brought on-site out to the facility to test all of the employees in that department and then sent those employees home. Once the cases came back, we knew that they weren't positive, so we brought the employees back 24 hours later. So a really great process to use on-site to help manage the exposure of testing, because if you do have a known case, you want to be able to test those within the department to make sure that those aren't impacted. And then once you get the all clear, you can bring them back after you've disinfected and you can bring them back to the work site safely. So you could use on-site as part of your strategy for testing should you need it. I throw that out there because we're using that for a couple of other employers as well. So we talked about OSHA's risk categorization. This is part of their COVID-19 plan. And OSHA created the risk pyramid, which you see on the right, from very high to lower risk employees. And so I put this table together for you to use as an exercise with your team. And you can see here, very high, high, medium, low. Very high would be nurses working on the front lines with COVID-19 patients. High would be maybe a construction company that's building a new wing at a hospital to support the COVID-19 testing, right? Not at the epicenter, but very high. They're in known exposure areas, so their risk is greater. The medium, jobs that require close contact to general public and potentially infected people. Keyword is potentially. But maybe you have an operation where you're doing deliveries, and that delivery driver is going out into the general public to another customer site. They're more exposed, although you don't know if there's the exposure at the other site, but they have a greater risk, so therefore they'd be categorized under the medium. And then the low would be jobs, administrative jobs, people working from home, minimal contact with the public and other coworkers. So start to think across your organization. Where do your different departments or your employees fall in these different categories? And you can list them by department, and then what are the associated risks? And then from that, what PPE or what exposure control plan strategy are we going to implement to keep those employees safe? And that can roll all back up into your exposure control plan, which we've outlined within that module that I showed you. Let's go to the next one here. Okay, worksite cleaning procedures. So are you disinfecting? What is that process? Is it daily? Is it twice a day? Is it once a week? Are you doing it internally with your own janitorial team or your administrative team? Are you using approved chemicals? Who's responsible for the management of that disinfection process? And then how do you verify that you've completed it? And so I put together this daily safety and health cleaning inspection form, and you can see all the different requirements there. Again, this is a Word document. We're going to send it to you. It's all editable, so you can change it, put your logo on it, put your name on it. Maybe it's not daily, maybe it's weekly, whatever you decide, but have a plan and have that as part of your exposure control plan strategy. Remember, if OSHA comes out and does an inspection or an audit, where your employees ask, what are your disinfection processes? You've listed them out, but then you've got the verification. So trusting that it's happening, but you're verifying that it's done through record keeping. And then you're maintaining these records to prove that you're implementing your COVID-19 mitigation strategy. One thing that I did find interesting as I was researching what's the best way to discard contaminated materials, such as maybe we have a known infection and we're disinfecting. So the best strategy I heard was just to double bag it. You take all your PPE off, you take the contaminated material, put it in a Ziploc bag or put it in a bag, zip tie it, put it in another bag, zip tie it, tie it in a knot, and then you can discard it into maybe a touchless trash can if you have it. So hopefully none of you on this call have to go through this, but if you do, just know that you've got to have that as part of your process. Remember I talked about transmission control procedures. If there is an exposure, how are we going to mitigate the potential transmission or the spread? How are we going to continue to flatten the curve? And then most importantly, as I've talked about, kind of the underlying thread of this whole conversation is maintaining the records. You've got to have documentation to prove that you've implemented this plan. You've got to have documentation to show your staff, your team, what you're doing to keep them safe. And again, that's going to help overcome the anxieties as well as overcome the compliance requirements. Let's go to the next one here. Social distancing protocols. So if you haven't seen this before, Alameda County rolled out this social distancing protocol requirement very early on. The rest of the Bay Area counties adopted it. Now we're seeing variations of it throughout the state. This is in a Word document. We have it in English and Spanish if you want. I recommend that you take this document, review it with your team, and once you're done, it's only 2 pages, you post it on your front lobbies to say, here's our social distancing protocols. And if you have visitors, if you have employees, if you have contractors that are coming in, you can also train them. We put together a 3rd page, which is an attendance form that just proves that you have trained the employees on these social distancing protocols. So again, another good tool that you can use to post in public places to let employees and other folks know that you have social distancing protocols as part of your exposure control plan. Let's go to the next one here. Step number 5, worksite controls. So there are numerous engineering controls we can take, from physical barriers to tape or paint or marks to identify safe distancing areas. I've given this example quite a bit to different employers. I went to the grocery store and I walk up front and there's a line out front. There's red tape identifying 6 feet social distancing requirements. And I walk up to the front finally, and I get there, I've got my PPE on. There's a guy in the front who's monitoring people going in, making sure that we don't have congestion within the supermarket. There's somebody at the back door signaling to him that it's okay to send somebody else in. So I go in, I go straight to the aisle where I know my stuff is, and as I'm walking down the aisle, I'm getting these kind of dirty looks from other customers that are walking towards me. And I had realized at that point as I looked down that there was red tape with red arrows pointing the one-way directional traffic that they wanted customers to take. But the one thing that they failed on was training me on that was one of their worksite controls. So I recognized that I needed PPE because they said that, but they didn't tell me, please follow the one-way directional traffic. So again, great engineering controls, good processes, they failed on the training. And so I give you that example because if you have developed a really good plan, but you haven't trained your employees on it, then how do they know what to do? So make sure that you communicate your plan clearly, from your disinfection procedures to your social distancing protocols to your PPE requirements. Those are really the 3 core initiatives that you need to have in place, and the documentation to support that. And the documentation would be, I train my employees on these 3 things. This is what we're doing to keep the spread down and to keep our employees safe. I've got some other administrative controls here from sick workers staying at home. A lot of things we've already heard because there's just so much noise about this out there. And then other safe work practices from health and hygiene frequency trainings. We're going to talk about some of that here in just a second. Let's go to the next one. Okay, so I've accumulated some really good CDC posters that I thought were really effective. The first one on the left is how do you properly don and doff or put on and put off a respirator? The CDC put out these guidelines. I thought this was a great tool. The second one is how to safely remove personal protective equipment in sequence. So if, for example, you have a janitorial team that's doing disinfection, maybe they've got more than just the mask. Maybe they've got gloves and goggles and aprons and so forth. How do they properly take it on, and how do they put it on, and how do they properly take it off? So another good CDC one-page training tool. The middle one is feeling sick. So we're putting this one up at a lot of different job sites. We're putting it on the front lobbies, the front doors of entrances. We've really kind of put this everywhere because it's really important for employees and visitors and the general public to know that we've got mitigation practices, and if you are feeling sick, you can't come into the facility. The fourth one there is hand washing, and there are probably 100 different hand washing posters on the CDC, as you can see in that top link up there. There's English and Spanish. There's one for families, one for schools. I put together a few just from the professional environment. Great place to maybe put this in your kitchens, put this in your bathrooms. So again, plaster your facilities with these tools. So again, you're raising the awareness, although we don't really need to raise the awareness because we're very hyper aware of it. However, this is part of your overall mitigation plan. Putting the information out there, making employees aware, training employees on what the requirements are, maintaining documentation, and so forth. And then this last one, stop the spread of germs. This is another handout you can provide to all new employees or the employees that you're rehiring and bringing back. Again, it's part of your overall exposure control plan strategy. Let's go to the next one here. Okay, so now we've put the plan together, and now we want to reopen. We want to bring people back. What's our strategy? Right? We've got all the tools, we've got the practices in place, we're implementing them, so we're starting to maintain documentation. Here is a 6-step kind of sub-layer reopening safety reboot that we're calling it. Let's go to the first one, Sinead. So as we're bringing the employees back, I put together what the expectation would be from an administrative level, and then what the expectation could be from a department level. So first, as I talked about, we're reviewing the job description, and then we're working through the Cal OSHA requirements from having a safety and health policy, which is element number 1 in your IIPP, assignment of responsibility for your safety program. 2, we've got the IIPP, 3. 4, we've got the code of safe practices. And what we work with employers to do is combine 2, 3, and 4, and then create that employee safety handbook, which is number 5. And that employee safety handbook is going to help you comply with about 75% of OSHA's requirements. And then the next step would be, we've got our exposure control plan, which we've given you a version you can edit. You're going to review that with your team. So go through the job description, go through your safety requirements, go through your exposure control plan. That's at the administrative level. And now we're going to bring that employee into the department. And there might be department specific trainings like job safety analysis, JSAs, or standard operating procedures, or our engineering controls related to COVID, or our PPE requirements within this department, or disinfection practices. So we've brought them one layer down into their department. That department manager is giving them specific training on how they're going to be implementing that exposure control plan, as well as their injury and illness prevention program. So start at the administrative level, bring it down to the department level, and have your strategy adhere to those two different levels of departments. Let's go to the next one here. So to help you with that, we put together this rehire safety onboarding checklist. And you can see here, we've got administrative training, we've got department training. So as you're bringing these employees back, here's some check boxes that you can go through to make sure that you've reviewed what your exposure control plan and your IIPP says, and then also from the department level, what the department managers are going to be training them on. And you can see we've got the manager's name and signature, we've got the employee's signature. So again, going back to the documentation, here's how we're implementing the plan, here's how we're bringing the employees back, here's the training documentation that we're going through, here's the signature that I have worked through this with them. So again, if they come back and say, well, I got COVID-19 here, like, well, we went through all these policies, you saw how we're implementing them, chances of you getting here are very slim. That would be part of your investigation that you would provide to the insurance carrier as your defense mechanism against any potential claim. Even though we know it doesn't become compensable, who knows where this is going to go. So very important to have the documentation in place. Let's go to the next one here. A daily home health check. So we've worked with a lot of employers who all said we're going to have somebody at the front desk screening employees, temperature taking, making sure that they're not symptomatic before they come into the work site. And so we talked about moving upstream and having this daily home health check. Employees can put this on their mirror, on their refrigerator, ask themselves these questions each day. And we have this in English and Spanish as well. So do you have any of these symptoms? If you do, or you can answer yes to any of these questions, don't come in. Contact HR, contact your supervisor, let them know that this is happening, and then we can work through what we're going to do to quarantine you and then bring you back safely so that you don't infect others. And that's really the goal here, is to minimize the spread and keep people quarantined so that we can flatten the curve. So again, this is a Word document. You can modify it, change it, but I really like just the infographic use of it. If employees are having any of these symptoms, we don't want them to come to work. And I've had a lot of questions about employees with allergies. And think of it this way: if you're going back to work and you're going to sit in an office, even though somebody's 6 or 10 feet away and they're sneezing their head off, the alarm bells are going off in your head. And so, working through what even some of those allergy season issues are, because we're having a lot of late bloom here. So, think through some of those requirements. How are we going to address people with allergies, people who have a cold that might not have COVID 19? But again, we've been so hardwired to be fearful of this. We don't want people to feel like they're exposed, because that heightens the anxieties, heightens the concern about, I got infected, I'm taking that back to my home. So anyway, kind of think through what some of those psychological hurdles are and some of those specific challenges, as well as the initiatives to mitigate it. Let's go to the next one here. We talked about the daily cleaning inspection form. So here it is again as part of your part 3, 6.3 of your implementation strategy. So again, I encourage you to have disinfection procedures and then verify that you've done them. And this documentation is going to be very important to stand up in any kind of workers' comp claim, Cal OSHA citation, and so forth. As well as it's also proof to your employees that you're adhering to the programs that you put in place. Let's go to the next one. Personal protective equipment. Again, on the far left side, we've got this in English and Spanish. We put together just a quick infographic. Here's hand hygiene requirements. If you're wearing respirators, here's how you don and doff them. If you're wearing gloves, which might vary by department. Again, trash bins, we talked about how we're going to discard potential contaminated PPE or contaminated waste into trash bins. If you have the touchless trash bins, it's even better. If you do discard contaminated waste or potentially contaminated waste, you want to make sure you disinfect the trash can as well. So have that as part of your procedure for your janitorial team. We talked about donning and doffing respirators, as well as the PPE sequence of removing potential contaminated PPE. So again, here's 3 training tools you can use to train your folks on PPE. They have attendance forms for each one of them. So again, signatures on the form that you've trained them, maintain those documents, and that is proof that you've actually implemented your exposure control plan. It also allows you to enforce your safety program if somebody, for example, is not wearing their respirator and they've been trained to do so. And that is actually element number 3 in your injury and illness prevention program. So as we look at the IIPP, assignment of responsibility, communication to employees about our safety program, here it is. Training of employees about our safety requirements, here it is. And then enforcement if they don't adhere to that. So all that is part of your umbrella, which is your injury and illness prevention program. And obviously record keeping, which is the most important piece, because if you didn't document it according to Cal OSHA, you didn't do it. Let's go to step 5 here. Physical reconditioning and site reorientation. So I talked a lot about this throughout this presentation. Police have been sitting at home. We're going to bring them back. We're going to expect that they can do the physical work that they did prior to COVID. So are they fit for duty? Have you reviewed your job description with them? Ask them if they're comfortable with doing this again. Can they ease back into it? We adapt really quickly as humans. So we've adapted really quickly to working at home and sheltering in place. We want to make sure that we adapt employees quickly back into the physical requirements of their job. I love the word kinesthetic sense. It's really your muscle memory. And if you've worked at a facility for a year, 10 years, 15 years, 20 years, you've developed muscle memory on how that facility is laid out, where machines are, where desks are, where cords are. And if you've re-engineered your work site now, don't expect employees to just adapt to that. Train them on it. Do a re-site orientation of how you've reconfigured the organization to adhere to the social distancing requirements. We're going to have turnover. Some employees are going to come back. Some employees aren't. Some employees are going to come back part-time. It's going to be a a real challenge from a transition standpoint. So we want to make sure that we provide the employees with our training program, with the resources that they have available, like the EAP, and again, get them comfortable with coming back to work so we can overcome this. Let's go to the last one here. So we've also prepared a couple of safety reboot trainings. Again, you're going to get all this information, so you can send this to the employees. We want to get them physically prepared for the job, emotionally and mentally prepared for the job. And when we get back to work, we want to get back to safety. We want to get back to a good attitude. That's going to be hard, especially for the first few weeks. So how do we reestablish that good attitude right from the beginning? So a lot of tools here for you. We're going to send this information out to you. It's all in Word documents. You can modify it, get ready to implement it, and then bring your employees back safely. I'm going to throw it back to Camila here to close out.
All right, thanks, Anthony. So what are the next steps here? Organize your reentry tools. All of the things that Anthony just went through in detail that he mentioned will be sent out. And get things ready, post materials and information where they can be seen by both employees and customers. The importance of review with each new hire and also with current employees to make sure that they are up to date on the new protocols and know how to utilize the plans and procedures that have been laid out, so that there aren't any misunderstandings or miscommunications. And as we've mentioned multiple times throughout the presentation, that manage, verify, and maintain records. So documentation, documentation, documentation. As Anthony mentioned, OSHA has really stepped up their investigations and their inspections, and given the excuse because of a injury or COVID claim, they are reviewing absolutely everything, including materials that are not related to the injury that has occurred. So all of a sudden now they are asking to see copies of your, infectious disease preparedness plan, your IIPP, your hazard communication, lockout, tagout procedures, disinfection logs, how you're disposing of contaminated PPE. So, ultimately documenting everything from how you're treating the payroll now during COVID to all of the safety procedures and steps that you have taken in response, just to go ahead and prove and verify what it is that you've been doing. And then also, get ready to return to work. So as you can see here, we have a number of COVID resources available to you, both through the ESM Insight website, as well as the Brown & Brown of Northern California website. Brown & Brown Insurance has a litany of COVID-19 resources available to you, including but not limited to exposure control plans, return to work programs with policies, trainings, remote work programs, ergonomic policies for workers that are working from home, and a lot of other things as well. So we definitely want to thank you all for joining us. I think we do have a couple of questions here. If Anthony, maybe you want to address real quick before we close out. Looks like what level of PPE and sanitation is required for a small 6-employee professional office space, and what is going to be reasonable?
Well, the good thing about any employer that has less than 10 employees means you don't have to comply with the standard. So OSHA, Cal OSHA's IIPP requirements are for employers with 10 or more employees. Now, even though you might not have to comply with the standards per OSHA, I have seen OSHA issue citations to a 5-employee company. So what I would recommend is take the tools that we've given you and come up with a very simple plan. You have 6 employees. I have one office environment, about 15 employees. They have told their property manager not to send in their janitorial crew to their office to clean it. They're going to actually clean it themselves. And so then they've shared that responsibility across the team. It's easier when you have a smaller team because you can all work together in overcoming these requirements. But again, you don't technically have to require or are required to comply with them. However, I do think it's very important that you do have a plan in place. If you can do social distancing, 6 feet, maybe stagger shifts, maybe some people come in opposite days, do require masks. If you have a common kitchen area or break room, maybe close it down during the summer, especially have people sit outside. Just continue to try to practice some of these requirements. And as I mentioned very early on, there's no one size that fits all. So work together as a team and come up with what your disinfection plans are going to be, your PPE requirements, and then your social distancing requirements. And I think you'll find it's very simple to implement and manage. You just need to adhere to it and then have some documentation around. We trained everybody on PPE. These are disinfection processes. And maybe you're cleaning once a week. Maybe you're cleaning once a day. Again, there's no, it's a hard thing about OSHA. They don't ever give you the frequency guidelines. They just say you have to do it. So it's best to come together as a team, work through the exposure control plan that we have, use that as a tool to have those, have that dialogue with your team and then come up with your own personal plan.
Excellent, thank you. So it appears that we don't have any other questions. If you do have additional questions that come up, feel free to reach out to us and we can discuss offline. As Anthony mentioned, the materials that were shown during the presentation will be sent out, and they are also available through the ESM Insight website. And most importantly, thank you all for joining us today. We will be hosting additional presentations and we'll be sending out the invites for those as well. But thank you for your time and consideration. And we look forward to working with you. Everybody stay safe and have a wonderful day.